Today we will be discussing the Metaneb. Metaneb is a therapeutic device that helps to enhance normal mucus clearance and resolve or prevent patchy atelectasis. The device has the ability to provide 3 different therapies: CPEP, CHFO, and aerosol. CPEP, or continuous positive expiratory pressure mode, uses continuous positive pressure to help hold open and expand the airways. CPEP is designed to prevent or reverse atelectasis, aid in mobilization of retained secretions, and reduce incidences of air trapping. CHFO, or continuous high-frequency oscillation mode, uses continuous pulses of positive pressure to oscillate the airways. This helps to move secretions to the upper airways and assists the patient with coughing and deep breathing. The third option, aerosol, is used to begin the treatment and when the patient requests a break from the CPEP or CHFO.
To deliver the Metaneb therapy to the patient, first make sure you have all the necessary equipment for the treatment. For patients requiring aerosol medications, a small volume nebulizer can be attached to the circuit and given during the Metaneb treatment. If using an air clips nebulizer, make sure it is set to continuous flow. Before beginning the treatment, be sure to check the patient's chart, verifying doctor's orders for the Metaneb. Wash your hands and put on gloves. Check the patient's armband to assure that you have the correct person. Then perform an assessment on the patient. Connect the Metaneb to the oxygen source. Then connect the circuit to the power box. Making sure the circuit is properly locked into the power box. A mouthpiece or mask can be attached to the circuit. Assessing your patient is the best way to figure out which piece is most appropriate. Since your patient is awake and alert and oriented, the mouthpiece will be used for the treatment. Turn on the Metaneb and adjust the dial to CPEP. Occlude the patient port and adjust the CPEP flow level until the manometer reads 10 centimeters of water pressure. The patient should be able to achieve the 10 centimeters on each exhalation. If this is not achieved, the flow must be manipulated until the 10 centimeters of water pressure can be attained for maximum therapeutic effect. Attach the mouthpiece and instruct the patient to make a tight seal around the mouthpiece and keep their cheeks tight. The patient should begin breathing normally through the mouthpiece. Encourage a slow exhalation of 3 to 4 seconds. When using the Metaneb, the amount of time the patient uses the CPEP and the CHFO depends on the individual. For patients with more atelectasis, the CPEP mode can be used longer. For patients with copious secretions, more time can be spent in the CHFO mode. After finishing CPEP mode, inform the patient that you will be switching to the CHFO mode. Explain that this mode will deliver pulses of gas, making a noise similar to a choo-choo train. Instruct the patient to continue breathing normally with tight lips and cheeks. Then switch to the CHFO. Begin on the lower pulsation setting, switching to the higher setting if the patient can tolerate it. Metaneb treatments generally last 5 to 10 minutes. When finished, turn off the unit Unplug the O2 source. Ask the patient to cough. Provide tissues or a sputum cup for any secretions. And reassess the patient and document the procedure.
Metaneb is indicated for use in mobilizing secretions, lung expansion therapy, and the treatment and the prevention of atelectasis. It may especially benefit patients with diseases such as bronchiolitis, cystic fibrosis, asthma, chronic bronchitis, bronchiectasis, emphysema, and COPD. Contraindications for using the Metaneb would be patients with a pneumothorax or a history of pneumothorax, subcutaneous emphysema, myocardial infarction, vomiting, pulmonary hemorrhage, and increased intracranial pressure. When indicated and used properly, the Metaneb serves as an excellent choice for bronchial hygiene therapy.